Afternoon, colleagues. Hope everybody's well and welcome to our weekly team talk. For those who I haven't met, I'm Jill Hunt. I'm the Interim Director of Nursing and delighted to be here. In terms of format today, I'm just going to say a few words by way of introduction, and then Andrew Thacker, our HR Director, is going to join us and give us a bit of an update and briefing in terms of some of the topics that I think would be helpful to give colleagues an update on. And then Rob Clark, who is our Interim Director of Finance, is going to come and say a few words, and then we'll go through our Q&As. Other colleagues are on the call and we'll bring people in depending on any of the questions that come through. As usual, we've got a number that have come ahead of the call and we will keep an eye on the chat in case there's anything for us to pick up. Before I hand over to Andrew, can I just say a huge thank you? I know it's really busy out there and everybody's working really hard. So just a huge thank you from all of us for everybody's efforts. I know it's sort of really a difficult and busy time of year traditionally for us in the NHS. So a huge thank you. So I think I will hand over to Andrew in the first instance. So Andrew, thank you.
Thanks, Jill. Good morning, everyone. For those of you that don't know me, I'm Andrew Thacker, Director of Workforce and OD. I just wanted to update on a couple of really important issues, some of which we've touched on previously in this session. And the first one relates to some really positive news around our healthcare support worker payment that has been rumbling on for a little while here. So for those colleagues that might not be aware, there was a dispute with Unison, the trade union, in relation to some of the rebanding of some of our healthcare support workers that took place back in 2024. There was quite a number of colleagues that were impacted by the rebanding. Unison lodged a dispute in relation to that, and in particular, the amount of back pay that colleagues were due. We've been through a process of negotiating with trade unions as to what that deal might look like. And then more recently, getting that approval to pay that through the Treasury because of the type of payment it was. And the amount of money it involves from an organisation perspective, it was really important that we did that. I think Steve and I have held a couple of sessions with colleagues just to update people on where we are with that. And we finally got that notification through to say that we have approval to make the payments. So as you would imagine, we're working really hard in the background now to try and prepare to make those payments. Our aim is to get those payments through payroll by the end of February, so in line with the normal payroll run. There's lots of queries coming backwards and forwards. Does this apply to me? What am I due? For those colleagues that this impacts on, you will be getting an individual letter that will set out details of what the dispute settlement looks like, how payment has been calculated, and what you should expect to see in your pay packet, including, I think, talking to payroll colleagues earlier this week, what element that will fall under on your payslip, so you should be able to identify it really easily as well. We will get some comms out to everyone in relation to this. I think the important thing for those colleagues that are expecting something, you will hopefully get an individual letter. We're looking to get those out week commencing the 2nd of February. So I hope I haven't stolen too much thunder in terms of the briefing that is due to come out to colleagues, but I felt that it was really important that we update you on that today. The second thing that I wanted to just touch on was the outcome of the employment tribunal that relates to changing room facilities. So just again to make colleagues aware that we have now got the outcome. As you might expect, it's got an awful lot of detail in there. We are aware that we do need to make some changes to our policy and to our arrangements. We're working through in great detail what that looks like at the minute, and we will get a briefing out to colleagues as quickly as we possibly can in terms of what that means. So there may well be heightened media activity, social media activity. I think we touched on this previously, that really is in relation to what this is about. The important thing is we will get that briefing out to colleagues as quickly as we can in terms of what that means in practical terms. Thanks, Jill. I think those were the two things that I was picking up.
Thank you, Andrew, and we'll bring you back, I'm sure, when we'll go through some questions. But if I can invite Rob to join us. Thank you, Rob.
Yeah, thanks, Jill. Sorry, I was a bit later. I was having IT issues. So just wanted to talk about something that we don't always like to talk about, but it's worth updating everyone on our financial position. We're in an unusual situation this year for County Dunbar and Darlington in that we are going to be reporting a deficit. That's where our expenditure exceeds our income. And we are getting lots of support locally from organisations in our direct area. But actually, we do still have quite a lot of a big deficit to sort of try and tackle. One of the ways in which NHS trusts have to do that is to deliver savings. Now, I just wanted to sort of make it clear to people, given the past that we've been criticised for being too financially focused in this organisation, that actually patient safety, quality and finance all go hand in hand. And actually, if we do things right for our patients, if we ensure the best quality services, then finance will also just drop out of that. That might sound overly simplistic, but I just want to sort of make it clear to people that we will not be prioritising finance over patient safety and quality. However, we all still have a duty to live within our means. Try and identify the way we can work the most productively, the most efficiently, and the most effectively. So it's really just an ask, as we're asking everyone in the organisation to keep an eye out for ways that we can increase efficiency and productivity, make ourselves the most effective, and in doing so, save money, as we really try and tackle the deficit position that we're now in. Thanks, Jill.
Thank you, Rob. Before we go through our questions, just a few bits from me. We were asked to give an update in terms of CQC inspection activity. So I'll just touch upon that in terms of where we are and some of the things that we really need to focus on both now and in the future and in a sustainable way. So as you know, we've had a number of inspections at the back end of last year. We had an inspection of our surgical services. We've had an inspection of our community services, and we've had a well-led inspection. And I'm sure colleagues are aware that we've had some warning notices from the CQC in relation to surgical services and on our well-led. We didn't have any immediate concerns raised associated with our community inspection activity. I think it'd be fair to say a lot of the stuff that they raised are things that we're cited on. So, for example, things like care of deteriorating patients, how we risk assess patients, some of our backlogs in terms of incidents and complaints, and the CQC as our regulator have given us some set timeframes to make demonstrable improvements. From a surgical perspective, we have to demonstrate to both ourselves, our board and our regulators that we've made improvements by the 2nd of March, which is 5 weeks on Monday. And if I'm honest, they're things that we need to be absolutely assured of in every ward and department in our service. You know, so are we effectively undertaking observations? Are we escalating and responding appropriately? All of the risk assessment pieces and documentation. So as I say, that's something across the board that we absolutely need to be focused on. From a well-led perspective, we need to be able to demonstrate significant improvements by the 22nd of April. And those things really are associated with the way we govern our organisation, our clinical governance, our management of risk. And I appreciate there's a lot of change at the moment, and I appreciate that that feels unsettling for people, but we are working really hard to make sure that our structures in terms of management of governance and risk are fit for purpose. So there's an awful lot going on, so please do bear with us while we look to some of that reset to really address the organisational challenges that we have, to make sure that they are fit for purpose and that they give colleagues the framework to operate within. So in terms of timeframes for inspection report findings, we haven't got definite timeframes from the CQC, but I would imagine they will be in the coming months that we will have those reports. So just wanted to touch base on that and make sure people were aware of that. Just a couple of well, just one sort of very practical thing from me as well is I know colleagues will be aware how challenged we are in terms of healthcare associated infection rates within the organisation, absolutely notably Clostridium difficile and MRSA bloodstream infections. One of the pleas that I've had from a number of colleagues in the organisation is that we need to be much better at recording patients who are in cubicles so that we can use our cubicles to the best effect. So just a reminder, please, from me to make sure people are inputting patient details into the system, which we can then use electronically in terms of that risk assessment. And I think they were probably the bits that I wanted to pick up on. So I think we will now move on to our questions and answers. Andrew, do you want to, if we go through the ones that are associated with you first, would that be okay?
Yeah, happy to. Thank you, Jill.
Have you got them to hand, or would you like me to just?
I have. No,
Oh,
I've got them. So quite a few, I think, coming my way this week. The first one that we've got is in relation to Nurse Bank pay rate. I apologise if I'm not seem to be looking directly into the camera. I have got the questions on another screen, so I'm using two screens. First question in relation to Nurse Bank pay rates and a suggestion that they're not increased in line with the 2025 pay award. We did issue a briefing earlier this year. I think it came out probably around summertime, August time, and the bank rates were increased in line with the national pay increase effective from the 1st of August. So please do look to see if you can find that briefing, and if there are any further queries on that, or if there's anything specific that somebody would like me to pick up, then I'm happy to do that. But yes, we've certainly enacted that as an organisation. The second one is in relation to minimum wage and cost of living rises, and we've touched on this a little bit. I think last week we had a similar question, and colleagues querying whether or not we did actually get both of those last year. It's a bit complicated, if I'm honest, because the national minimum wage is announced nationally, and what we need to do if the pay awards haven't been approved or negotiated or approved in line with that, we then need to put in some temporary arrangements, normally, which again, we get notified nationally of what we should do, just to increase people's pay so that they don't fall below the national minimum wage. When the pay award is then announced, it takes into account the uplift that we've already paid. So that might be why colleagues feel that they're not seeing the benefit of both the increase in national minimum wage and the pay awards that are usually announced a little bit later in the year. Just coming back to that point specifically, these are pay awards are negotiated nationally. They need to go through the approval route at a national level. Depending on how long the negotiations take and how long the approval takes, that's often why we don't see pay awards paid in April, but they do come through at a bit later date, backdated to April. It's not something that we do as an organisation. It is something that's done nationally, and we fall in line depending on what the national peer review bodies announce and the government then agrees. So that's sometimes why there's a bit of a time difference between things like national minimum wage and the Agenda for Change pay awards coming through. We have had lots of discussions with colleagues nationally about trying to close that gap because it's not particularly helpful for us as organisations. And I know that there's been lots of lobbying for some of the timescales in terms of negotiations and approvals to be looked at to try and avoid that. So yeah, please do bear with us. I think what we try and do at all times is make sure that colleagues are informed on this. I know there was a query last week about if the national minimum wage increases and the pay award isn't paid in April, what happens? We will get some comms out to you just as soon as we understand the likely timing of the Agenda for Change pay award. Our payroll colleagues are aware of that, so please bear with us. There's a question in relation to somebody who has been seconded for quite a significant time. I think the easiest thing is for me to take that offline, and if the individual would like to make contact with me directly, then we can certainly look into that for you. Happy to do that. And I think the last one for me in this week's list is in relation to mandatory training. It is essential to ensure that we continue to work to policies and procedures. And I appreciate that it's often a real pressure for people to complete their mandatory training whilst at work. I think the question specifically is, are we expected to complete this in your own time? And the answer is no. In line with the policy, we would hope that people do get time rostered in to enable them to do that. People do have a choice in that. And I know that colleagues often find it easier to do some of it at home, and that's entirely your choice. But I think in line with the policy, there's no expectation that colleagues do this in their own time. There's also a second part to the question around new members of staff commencing and needing training, and them not being able to access ESR to enable them to do that prior to their commencement. So this is something that used to happen. And if I wind back the clock pre-COVID, there was 2-day-long inductions where people got an awful lot of their training face-to-face that enabled them to hit the floor, so to speak, running with all of the training requirements in place. And a lot of that was then converted into mandatory training. We did allow people access to ESR and ask them to complete the training prior to them starting. What we found was that elongated people's start dates for those that hadn't completed the training on time. It meant that we couldn't allow them to start until that training was complete. So that's why that arrangement changed. But I think accepting that this is a challenge for most people, we do need to relook at the way that our mandatory training, especially for new starters, I think is organised and coordinated. So I will take that back, and we can have that conversation with the team and others.
Andrew, while I've got you, there's one
Yes.
question in the chat around funding for external courses, and you probably won't have had a chance to see it. I don't know if you're okay to pick that up. People ask about funding for things like masters.
Okay, I'll try my best, Jill. I think as you might not be too surprised to hear, funding in relation to training courses has been significantly reduced in the last couple of years. So there are development funds that have been made available to us previously that no longer exist. Having said that, there is still opportunities for colleagues to access training courses through some of our local partners, such as Teesside University, and there is also ring-fence funds for certain colleagues, such as qualified nurses and AHPs, that should still be available as well. So it is limited, it has to be said, but there are still some development opportunities out there for colleagues, and I think it kind of links back to appraisals and development plans, service plans, and the like, as to where that kind of development is prioritised. But yes, in short, Jill, I think there's some funding there, certainly not as much as what we've seen in previous years.
Thanks, Andrew. Thank you. Okay, Rob, there's a couple for yourself. Are you okay to pick them up? Thanks, Rob.
Yeah, absolutely fine. No problem. So a couple of questions. First one relating to signing of new contracts for equipment. The question is sort of around, there are often delays. It's not always clear on where the delays are, and how are we dealing with that. So I'm not sure everyone will have read all the words of the Albury report, which is one of the reports that was commissioned into the situation that the Trust found itself around governance. But one of the items in that report was around how we manage contracts in terms of ensuring they're signed on a timely basis, that they're correct, and then that we contract manage those. So the reason I'm telling you that is because as a consequence of that, we've launched a big piece of work looking at all our contracts across the Trust. And indeed, we are trying to streamline the contract approval process as well. So our procurement team is doing a massive exercise at the moment around all of the contracts. So we're capturing data for all of the contracts we have, making sure we know when they're up for renewal, making sure that we are involving the right people vastly in front of the time and when they're due to be signed, and therefore keeping on top of all of that and ensuring a clear view of all contracts and when they're due to expire and whether they need to be re-signed. Now, I appreciate that's contracts that we've already got in place, but new contracts, which is a question rather that was specifically asked, as I say, that's a process that we're going through at the moment in terms of streamlining approvals and recognising who needs to sign those and when. This is also linked to a piece of work we're doing around the scheme of delegation in the Trust. The scheme of delegation is what informs people of what they can sign and sort of which value and so forth, which has been a little bit unclear. So in a direct answer, it's work underway, and things will be getting better and clearer in the coming weeks and months. But we are on it, and workflow, we're going to try and make it all through SharePoint and be really, really transparent. The second question I had, which is sort of on a similar vein in terms of approval processes and so forth, is around business cases. So the question is that somebody's unclear of what the business case approval process is, and that they didn't feel they were getting the level of support they needed to get the business case approved. One of the things that is linked to my comment earlier about the financial position we find ourselves in as a Trust is we simply don't have enough money to fund all of the business cases that we're working on at the moment. So in CLT, the Collective Leadership Team and other forums, I've tried to give guidance as to how we should be approaching this. And basically, the bottom line is, unless your business case relates to improvements to patient care and the quality of care, unless it is externally funded or unless it's an invest to save scheme, we're really discouraging people from drafting business cases at the moment. This will save people a lot of time because people are also saying they're very, very busy and they need some prioritization. So unless your business case meets one of those criteria, really, really do review whether you should be drafting business cases. Now, also, business cases that are coming through to for approval need to be sponsored by your care group, or if you're in a corporate area, by the exec lead for that corporate area. So if in doubt, speak to those people. That will make it very clear as to whether you should be proceeding with that business case or not. And then following that, if those business cases are approved by your exec lead for your corporate area or your care group leadership team, then they will come through to the collective leadership team or the SCIB meeting for consideration before going on towards the board if necessary. We can get that written down if that's unclear to everyone, but that hopefully will give you the guidance you need as to whether you should and how you do if you are pulling a business case together, how you get it approved. Thanks, Jill.
Thanks, Rob. Thank you. So there's a couple more questions that I will just whiz through for colleagues who aren't here. Lorraine is unable to be with us today and Steve is travelling, but they've given us their responses to share. There was a request for surgical colleagues to come and share the work that they're doing around support for patients waiting for planned surgery. So we will absolutely arrange that for a future session. There was an ask in the chat actually of Steve visiting or revisiting sites that he has been to, and I'm sure he will be factoring that into his work schedule because he is out and about an awful lot. So we'll make sure that that's fed back to him. There's a couple of questions for Lorraine. One was around cancellation of appointments and a perceived increase in cancellation of patient appointments. And Lorraine has responded that there's an awful lot of work looking at our booking processes, better use of tech. And she said it would be great to hear any suggestions, so please feel free to reach out. There was a very specific question around cancer care coordinators, which I think was raised a few weeks ago, and I know Andrew and Lorraine are going to pick that up offline with colleagues. You know, we absolutely will commit to doing that. There's one here that Lorraine has commented on, but Shafi may want to come in. A query around plans for Bishop Auckland Hospital from a surgical hub perspective. I guess more broadly around the future of Bishop Auckland Hospital in that regard, and Lorraine has commented that there's a commitment in terms of the development of the surgical hub. Shafi, I don't know if there's anything to add to that at this point.
No, I don't think so. I think it's fairly clear that there's a commitment to Bishop Auckland as a surgical hub. That's there. Thank you.
Lovely, thank you, Shafi. And then the last one that we had, which is probably one to share with comms, was a comment from a colleague around damage to parked cars and people not leaving their details. So we absolutely need to be very cognizant of that. We do have a couple of comments in the chat around parking that we might need to bring back as a theme, because it's obviously something that's on lots of people's minds. Okay, I'm just having a look. Yeah, lots about parking that we need to probably bring back. Okay. I can't see anything that we haven't covered, and we're bang on time. I will be out and about next week. I think I'm at Chesterley Street, and then I'm around some of the wards at UHND. So I look forward to meeting colleagues that I haven't had an opportunity to meet yet. And thank you all very much for all that you're doing, and look forward to catching up with you next time. Thanks very much. Bye.